Hi, my name is Christina. I'm going to be your nurse today. How are you doing? Ashton, how are you doing?
I'm good. How are you?
Good. I'm going to be your nurse. Can I verify your name and birthday, please?
Ashton Silverstein, August 24, 2004.
Great. Do you have any allergies?
Nope.
Okay, I see in your medical record that we need to go ahead and replace the dressing that's on your neck. Is that okay?
Mm-hmm.
All right. I'm going to have you go ahead and put this mask on. Going to perform some hand hygiene. I did that when I first came in, but we'll do it again. I'm going to have you turn your head towards the door as far as you can. In this instance, he is not going to take his shirt off. I'm going to go ahead and put my mask on. So getting access to this whole area, just so you know, may or may not be easy. I'm going to go ahead and perform hand hygiene again. I am going to get my supplies. We have all the, let me go ahead and close this door. Perform hand hygiene again. Going to adjust the bed to a comfortable working height. Make sure that because I'm in my room, I can't really adjust my table, but you would adjust the table. He's got his mask on. I'm going to go ahead and got my supplies here. I'm going to go ahead and put on clean gloves. In this instance, you want to make sure that the device is secure. Depending on how the IJ is, depending on how the dressing is, you want to make sure that it is taped down and secured. You want to palpate the site. You want to assess the dressing. You want to palpate the site. And, do you have any pain here?
No.
Okay, you're looking for pain, tenderness, discomfort. So for right now, we are going to, when you're assessing the site, you want to make sure that there is no signs of infection. Right now, we're going to go ahead and remove this dressing. We are going to pull from the outer edges in. Pull from the outer edges in. I'm going to remove that. Keep your head turned for me. I'm going to go ahead and remove the bio patch. And I'm going to go ahead and remove my gloves. I'm going to perform hand hygiene again. I'm going to go ahead and open my sterile dressing, making sure that we keep it away. I'm going to go ahead and perform hand hygiene again. I'm going to go ahead and take out my sterile gloves. Trying to make sure I get all this in the video because I'm very limited on space. Okay, I'm going to go ahead and discard this wrapper. Right here, if there's any blood or anything at the insertion site, you want to make sure and you go ahead and wipe off in a circular motion from the center outwards any old blood or drainage. And now using the CHG, you would go ahead and cleanse the site also using a circular motion from the inside, from the insertion point to the outside using a circular motion. You want to clean it for about 30 seconds, and you want to cover a 2 to 3 inch area. You want to gently go back and forth around the site, going slowly towards the outside. You don't want to go over the same site twice or contaminate. So you want to go around and around and around. 30 seconds. You want it to go ahead and completely dry. Now we're going to get the dressing. We're going to remove the back of the dressing. We are going to go ahead and get our bio patch, place our bio patch where it needs to go, and we're going to go ahead and apply our dressing. You want to make sure that the securement, you want to make sure that the site is secure before applying this dressing. You want to make sure that the dressing is somewhat comfortable for the patient, or as comfortable as it can get. For demonstration purposes in here, I'm going to go ahead and remove this because kind of in the way. From here, based on what your facility requires, you also want to measure the length from the center of the catheter to the outer part of the catheter. You want to document that in the EMR. You want to replace the end caps, working with 1 lumen at a time. One thing I did forget to mention earlier is you want to make sure that this line is clamped. If there's any fluids running, you want to make sure it stopped. I should have said that at the beginning, but it completely lost my mind. If it's required, you want to flush each lumen with saline or heparin, depending on the specific line and the orders. You want to scrub the end of these caps with an antimicrobial swab. You want to let them dry. You want to flush according to facility protocol. And you want to make sure that you put an antimicrobial cap on the end. Next, you'll time, date, and initial the dressing itself. If you need to secure it, you want to go ahead and make sure that it's in a comfortable position so the patient has less chances of it becoming dislodged. Now I'm going to go ahead and remove my gloves. I'm going to gather my trash. We're going to go throw that all away. I am going to remove all my PPE if I have any on, but first I'm going to wash or sanitize my hands, take my mask off. You want to go ahead and remove your mask. I think he fell asleep on me, so I'm going to go ahead and remove his mask. Thank you. And I'm going to go ahead and thank you for allowing me to change your dressing. We'll see you in a little bit, okay?